Men fare worse than women in the U.S. when it comes to high blood pressure. The medical condition affects African American adults more than other ethnic groups in our country. So those are the study findings newly released by the Centers for Disease Control and Prevention. Conducted from 2021 to 23, the studies show a whopping 44.5% of people are living with high blood pressure. Dr. David Persse, Chief Medical Officer for the City of Houston, is joining us now to offer all of us tips on how we can lower high blood pressure. Good morning. Thanks so much for joining us.
Hey, good morning, Amy. Thanks for having me.
Yeah, so I want those tips, but first I want to ask you, when you think of high blood pressure, the reason it's so important to get it under control is because that leads to other health problems. Can you kind of talk about some things that could stem from high blood pressure?
Yeah, and I think it's an important point that you bring up is that, first of all, hypertension is a chronic illness. It's not like the cold or the flu where you get it and it goes away. Once you get it, you can do things to manage it. We'll talk about those, but it tends to be a lifelong thing that you're going to need to manage because it can evolve and cause other problems. And it can eventually affect pretty much any organ system. But the ones we worry about the most are your eyes, your brain, your heart, and your kidneys. Those are the organs that it tends to damage early on. And what basically happens is the high blood pressure, your blood vessels are supposed to expand and contract with each pulse. And as you get high blood pressure and it stiffens those arteries, they can't expand and contract anymore. And then plaque develops on the inside of it. That plaque develops problems, and that causes things like heart attacks and strokes. So it's a sequence, it's a falling dominoes of, if you will, of problems. But if we could get the hypertension under control, a lot of those other problems wouldn't occur.
Well, we talked about so many people not knowing that they have it. What are some symptoms? I mean, I feel like this is one of the things as people get older, we always sort of ignore some of these symptoms because you think, oh, it's because I'm getting older. I mean, are there common things that we should be paying attention to?
Yeah. So here's the other thing about hypertension that makes it so difficult is simple hypertension, if that's all you've got, it has no symptoms. And so you'll have high blood pressure and not even know it. You don't develop the symptoms until your eyes, your brain, your heart, your kidneys, or something else actually develops permanent damage. That's when the symptoms, and by that point, it's not too late, but boy, sure would have been nice to have, eliminated or at least reduced your chances of those problems a lot of time earlier. So your point is right, is it really doesn't have symptoms. But that doesn't mean there's nothing you can do about it. There's a lot that you can do about it. So first of all, you can monitor your blood pressure. There are machines you can use to measure your blood pressure at home. The sort of threshold that most physicians want is they want to keep your blood pressure. There's two numbers. There's a high number and the low number. We call it the systolic and the diastolic. And they want to keep that below 120 and below 80. Those are the two numbers. We like to keep it below. Some doctors will treat it when it starts creeping up at slightly different levels. Most doctors will try to encourage you to do the things that you can do to bring your blood pressure down before they need to put you on medications.
Yeah, and so that's that number at the top and number on the bottom, like 120, 80. You want to be in those or below those. How can somebody, if you're taking those at home, maybe you're in between your annual visits to your doctor, how can somebody lower their blood pressure? They know it's a little high, but it's not alarmingly high. Are there things that we can do to bring that back down?
Yeah, so great question. So there are things that you can do to keep them down. And first of all, it's great that you monitor it. And yes, during the day, your blood pressure will naturally fluctuate up and down a little bit. So one reading I wouldn't get too excited about. But if you're persistently above that 120 over 80, I would absolutely go to your doctor. But in the meantime, the things that you can do are, number one, of course, remain healthy. Remember, your heart is and your blood vessels, they're organs, they're mostly muscle. Your heart is obviously muscle. Most people don't understand your arteries are mostly muscle too. And so the more healthy you are, the more exercise you do, you help keep those muscles in shape, just like you would your biceps or your calf muscles or any other muscle. So, being healthy, exercising a lot, it has a great impact on it. It also helps you keep your weight down. Remember, if you're overweight, your body has more blood to pump to more body, putting more strain on your heart and blood vessels. So you want to keep your weight down by eating healthy and exercising. One of the things that can really hurt you, and I know it's difficult to stop doing, but is smoking. If you're a smoker, the tiny little particles in that smoke get into your blood vessels and they irritate the lining of the blood vessels, and that contributes to high blood pressure. So smoking is one of the things you want to avoid if you can. We talked about taking your medications we talked about taking your blood pressure at home. And here's the other thing. if your doctor puts you on medication, you absolutely have got to take those medicines. Remember, one of the problems is that with high blood pressure, people don't have symptoms. And as an emergency physician, I can't tell you how many times I've treated a patient in the emergency department who's having a complication. I find out they've got high blood pressure. I find out that they've been prescribed medication, but they didn't take the medication because they said they felt fine. They didn't think they needed to. And so that's this whole sort of, conundrum of no symptoms, but you still need to take the medication.
Right. You may very well feel fine because there are no symptoms. Absolutely. So I know when women are pregnant that's a big thing, that doctors want to make sure that your blood pressure is good and normal. I mean, why is that? Why should pregnant women particularly pay attention to your blood pressure?
Yeah, another important thing about high blood pressure. So most ladies who are pregnant are young and healthy, right? And they don't have a lot of other health problems. There is a particular complication of pregnancy. It's called gestational hypertension. It means that you get high blood pressure while you're pregnant. It is due to the pregnancy. Generally, after the baby is born, the blood pressure will return to normal. But during the pregnancy, gestational hypertension tends to occur later on in the pregnancy, beyond about 20 weeks. It has its own set of really serious complications that can follow, including seizures. And there is about it's about a little bit, 2 to 8% of pregnancies will have this. The term we use is called preeclampsia, when your blood pressure gets high. And I won't go into all the details, but there are serious complications, including seizures. And yeah, it can be life-threatening to both mom and the baby. So again, moms, go to your doctors, get your prenatal care, watch the blood pressure, and if your doctor needs to manage the blood pressure, do what he or she says. You want to keep that under control.
Absolutely. Very good information this morning, Dr. David Persse. Thanks so much.